During resisted neutral testing, if there is a finding for internal rotation, manual muscle testing would be indicated. The following muscles are involved in shoulder internal rotation. The following scale is used to grade manual muscle tests. Grades 3 through 5 are performed against gravity, while grades 0 through 2 are performed in a gravity-eliminated position. To test the subscapularis, the patient is prone, the shoulder is abducted to 90 degrees, and the elbow is flexed to 90 degrees. The patient internally rotates without adducting. Resistance is applied proximal to the wrist. This places stress on the elbow and shoulder joints, and caution should be exercised. Gravity-eliminated testing is performed with the patient seated, with the shoulder slightly abducted. The therapist supports the arm through motion. The pectoralis major is tested with the patient in supine, with the elbow flexed to 90 degrees and the shoulder adducted to 90 degrees. The patient horizontally adducts the arm. The sternal head is palpated at the anterior border of the axilla. Resistance is applied proximal to the elbow joint in the direction of shoulder abduction. Gravity-eliminated testing is performed with the patient seated and the therapist supporting the arm against gravity through horizontal adduction. The latissimus dorsi and teres major are tested at the same time. The patient is prone with the arm at the side and the palm facing the ceiling. The patient extends the arm. The teres major can be palpated on the posterior wall of the axilla, lateral to the axillary border of the scapula. The latissimus dorsi can be palpated lateral to the inferior angle of the scapula. Resistance is applied proximal to the elbow joint in the direction of shoulder flexion and slight abduction. Gravity-eliminated testing is performed in side lying, with the therapist stabilizing the patient's arm against gravity. The teres major and the latissimus dorsi can both be palpated in their respective locations. The anterior deltoid is tested with the patient seated, with the arm at the side and the palm facing medially. The therapist stabilizes the scapula and the clavicle, and the patient flexes the arm to 90 degrees. The anterior deltoid can be palpated on the anterior aspect of the shoulder joint, just distal to the clavicle. The resistance is given just proximal to the elbow in the direction of extension. Gravity-eliminated testing is performed in side lying. The therapist supports the arm against gravity.